As a certified medical examiner, you know that your work is the absolute bedrock of public safety, and it all starts with one piece of paper, the driver's medical history. But, as you and I both know, what a driver writes down, well, that isn't always the full story, is it?
So let's get into it. We're going to start by looking at the core problem with the history form itself. Then we'll dig into why these forms can be so inaccurate. After that, we'll get into your practical guide, best practices, and the red flags you need to look out for. And finally, we'll tie it all together and talk about why this is so incredibly important.
All right, let's talk about the challenge you face with every single driver that walks through your door, the reliability of that self-reported history.
I mean, this is the million-dollar question for every DOT exam, right? You know that the form you're holding, whether it's because of an honest mistake or something more intentional, is often incomplete. It's your first clue, but you know better than anyone it is rarely the complete picture.
You know, to really get to the truth, it helps to put yourself in the driver's shoes for a minute. Let's break down the 3 main reasons you might get a flawed history form.
What's fascinating here is the range. The reasons can be anything from a simple, honest mistake, like just not getting the medical jargon, to a driver who's in a hurry and just breezes through it. And then, of course, you have the deliberate decision to hide something that could be disqualifying.
Let's dig into that misunderstanding piece. A driver might not have a clue that a condition they think is totally minor or completely unrelated to their job is actually a huge deal for their certification. They might just skip right over a past surgery or medication because they just don't see the connection.
And then you have the toughest one to deal with, pure fear. Some drivers will actively hide a history of seizures, or a recent heart attack, or a sleep apnea diagnosis. Why? Because they're terrified that telling the truth will cost them their job, their livelihood. And that puts you in a really tough but absolutely critical position.
So, the real question is, how do you get to the real story? Your expertise isn't just about the physical exam. It's really about the art of the interview. So let's talk about 4 essential best practices for your toolkit.
Okay, number 1, and this is probably the most powerful tool you have. Never, ever take the form at face value. You have to go through it line by line with the driver. This is your chance to clear things up, ask those immediate follow-up questions, and turn a static piece of paper into a real conversation.
Next, you've got to avoid the yes or no trap. You want to get the driver talking. Open-ended questions are the absolute key to unlocking details they might have just forgotten about or, frankly, didn't think were important enough to mention.
And here's a perfect example of what that looks like. A simple shift in how you ask the question can open the floodgates. It's a small change in your phrasing that can give you a ton of critical information you wouldn't have gotten otherwise.
Best practice number 3, use plain English. It sounds obvious, but you have to make sure you and the driver are speaking the same language. Just look at this slide. Swapping out myocardial infarction for heart attack gets rid of any confusion and makes sure you get a straight, accurate answer.
And finally, this is where you put on your detective hat. You have to compare what they've told you with your own physical exam findings and any records they've brought in. You know, if a driver says they're not on any medications, but their urinalysis shows high blood sugar, well, that's a huge discrepancy and a major flag that you have to investigate further.
Okay, now let's zero in on some specific conditions. Think of these as automatic triggers, the things that should always make you pause and dig a whole lot deeper. If you see a yes next to any of these on that history form, or if you even suspect one during your exam, that demands your full attention. It almost always means you're going to need more paperwork, more documentation from their treating doctor before you can even think about making a certification decision.
Look, taking all these steps, it's not just about checking boxes or following protocol. This connects directly to the massive importance of your role as a gatekeeper of public safety.
First and foremost, a truly accurate history is what helps you spot the medical conditions that could seriously impair a driver's ability to operate a rig's safety. Your diligence, your attention to detail literally prevents tragedies on our roads.
And beyond that, you have a huge legal and professional obligation to make sure every single driver meets FMCSA standards. A thorough, accurate history isn't just good practice, it's your best defense. It's proof that you did your job right, protecting the public and honestly, protecting yourself from a bad certification.
And last but not least, a detailed history creates that critical baseline. It lets you track changes in a driver's health over the years, making every single recertification exam more informed and more effective than the one before it.
So, when it all comes down to it, it's this. Your skill in getting an accurate medical history is the absolute cornerstone of the entire exam. It is the single most important factor that allows you to make an informed, responsible decision that keeps us all safe. That form is just the starting point. It's your expertise that brings the truth to light. For more information, please go to expressphysicalsllc.com.